There has been more testing in Leicester than anywhere else in the country.
Hi, we're here to offer the coronavirus testing kits. Have you had one? No. Would you like to do one?
I will.
Okay.
With volunteers knocking on doors to hand out kits to see who may be infected with coronavirus. Here in the city, they're not just testing those with symptoms. Anyone is eligible, and that's unlike most other places.
We've made some difficult but important decisions. We've decided that from tomorrow, non-essential retail will have to close.
When Leicester was locked down late on the 29th of June, it came as a surprise to many in the city who hadn't expected quite such severe restrictions. In the last hour, it's been confirmed that some restrictions in Leicester will stay in place, but some are questioning whether the city's lockdown was ever justified. In Leicester's famous De Montfort Hall, they're packing food for vulnerable people who are shielding at home. Labour Mayor of the city, Peter Soulsby, says the lockdown has been politically motivated. It's something the government deny, saying Leicester had an infection rate 3 times higher than the next highest city. But Soulsby says not all the data paint a picture you perhaps expect from a city under lockdown.
It's very interesting because one of the things we have been able to monitor all the way through the period since the initial lockdown in late March is the level of hospital admissions and, sadly, the level of deaths in the city. And both of those have continued to diminish almost now to the point where very few admissions are taking place to hospitals and even fewer deaths are taking place. There's been a lot of questions asked as to why, if it is the case that Leicester is suffering a significant outbreak, why that is not reflected in either hospital admissions or the deaths.
The Department of Health says admissions were higher in Leicester than elsewhere. But look at these graphs. This is the number of COVID cases in Leicester. You can see a sharp uptick from early June and then a steady fall subsequently. Now look at this graph. COVID weekly deaths in Leicester. There's no corresponding uptick in June or July. Instead, we see a gradual decline. So what's going on?
I think the likelihood it's a combination. I think we definitely had something that was genuine, but we've obviously ramped up the testing considerably as a result of that, so we are going to start to see those bigger numbers. And I think if you look at places like Oadby and Wigston, where their positivity is quite low, but because their testing numbers are so high, it gives that artefact of there appearing to be something that actually is probably not there to the same extent.
Ivan Browne suggested that this could be in part down to testing asymptomatic people and the potential for producing false positives. But he also said he struggled with the differences between the community testing results and those tests taking place in hospital.
There wasn't a relationship between the two elements, the numbers going through the hospital and the numbers that we're seeing within the community. From an epidemiological point, I found that was a surprise. And if we started to have those conversations about multi-generational households, well, actually, we'd still be expecting to see some kind of flag within those multi-generational households, the older people ending up in hospital. And that's not what we're seeing at the moment.
This sense of almost bafflement is shared by a number of doctors we've spoken to. They too were expecting to see a spike in hospital admissions, but it didn't happen. Leicester's intensive care units have not had patients with COVID for many days this week. The reasons for the lack of a spike in serious illness are unclear, and there are many theories circulating. But this virus is new and it's a new situation, and there are many questions that yet remain unanswered. Dr. Penny Campling is a retired psychiatrist and psychotherapist. She keeps a blog about healthcare.
People need to be helped to think intelligently about this virus and, make informed decisions, and I don't think we're getting that right. That's, feels like there's a lot of sort of sledgehammer policy going on.
It's difficult to know what considerations the government gave these differences in data when deciding to impose the original lockdown, then extend it further on the 16th of July. Newsnight has seen confidential data showing that 4 days before that decision was taken, 8 other councils had higher death rates than Leicester. The Department of Health says their decisions have been guided by data and science, but other people have told Newsnight it's unclear what the overall strategy is, reducing the burden on the NHS, preventing deaths, or reducing total infections. And if it's about reducing infection, then at what cost to the local economy, social cohesion and our well-being?
You know, I keep coming across people who haven't been out at all, who aren't shielding, but just have got very frightened, and that's a real worry. These aren't necessarily people with mental health problems to start with. This is a whole new lot of mental health problems, let alone the impact it's having on children and stuff.
Suleman Nagdi is patron of a bereavement service, the Muslim Burial Council of Leicester, and is a community leader in Evington and Highfields, which is home to a large number of the city's Muslims.
Within this area and the wider area that we talk about, that we serve the community, there has been one single death. So that in itself will give you an indication. And thank goodness for that, there's only been one death, but that tells you a different story to how this whole thing's been played out nationally. When I speak to people, they think that possibly we have been picked on. And it is not for me to say whether they have or they're not. It's a perception or whether it's actual, but this is the feeling in the community that why is it Leicester? Leicester's always enjoyed good relations with each other, and nationally we were possibly one of the model cities, and all of a sudden, within overnight, we've become the boogie city, to be quite honest.
The reluctance of people to head to a stigmatised city when lockdown lifts worries Dharmesh Lakhani, owner of Bobby's Deli on Leicester's Golden Mile, a street running through the east of the city and home to shops, jewellers and restaurants.
As a business owner, this is very stressful. The uncertainty about what's happening, who's going to come to your business, when are they going to come to us. In terms of businesses, generally, I think many businesses will close. In our area and on the Golden Mile, I am fearful of some of the smaller retailers and even some of the bigger ones, because a lot of them are in rented properties, and with the initial help which the government gave, which was great, but since then obviously another month and a half has passed, and really it's about getting people out again, and I think people are very scared. I think we initially, the government wanted everybody to stay at home, and I think they did, and they got very frightened, stayed at home. Now you can't get them out, so it's the opposite way. So
it's undisputed that Leicester saw a spike in cases, and the city has now succeeded in more than halving its infection rate. Thankfully, Leicester has not seen an increase in ill people with COVID, but when there are so many unknowns, there are trade-offs to be made between risking ill health from COVID and the wider impact on society.